Dr. Diva B, consultant in obstetrics and gynaecology, laparoscopic surgeon and a urogynaecologist working in Women's Center by Motherhood, Coimbatore. Today I will be speaking about abnormal uterine bleeding. So before going to the topic, we should know what is normal menstrual bleeding to differentiate between the abnormal and abnormal. So normal menstrual bleeding is based on the duration of the bleeding and amount of blood flow and also the frequency of the cycle. So normally the menstrual cycles will be last between 21 days to 35 days cycle, and the duration will be less than 7 days, and the amount normal menstrual bleeding flow is 80 to 100 ml. Abnormal uterine bleeding, the cycles will be less than 21 days or more than 35 days, and the duration of the cycle will be more than 7 days of flow, and we will be using more than 7 pads per day associated with clots is defined as an abnormal uterine bleeding. So why today I am speaking about abnormal uterine bleeding is because of the increase in incidence in the reproductive age group. So the prevalence of abnormal uterine bleeding is around 9 to 14% among all the age group of women, and it constitutes around 17.9% especially in the reproductive age group. And about 1/3 of the women in India suffer from abnormal uterine bleeding, and among them 30% of the women have menorrhagia. So menorrhagia is nothing but the heavy menstrual flow. So due to the incidence and the prevalence is more, we are today discussing about abnormal uterine bleeding. So coming to the causes of abnormal uterine bleeding, causes are classified based on the age group. So first will be adolescent age group, second is a reproductive age group, and third will be the perimenopausal age group. In adolescence age group, the more common causes are the thyroid disorders, immature hypothalamo-pituitary ovarian axis, and polycystic ovarian syndrome, and also the obesity. So based on these causes, we will be seeing abnormal uterine bleeding in the adolescent age group. Coming to the reproductive age group. In reproductive age group, the causes are classified into two types, that is structural causes and non-structural causes. Structural causes are nothing but there will be anatomical defects or any anatomical changes happening in the genital organ. So the most common causes will be endometrial polyp, fibroid uterus, adenomyosis, and endometrial hyperplasia. Endometrial hyperplasia is nothing but thickening of the endometrial tissue, which is the inner lining of the uterus. Second will be the non-structural causes. Those are the anovulatory cycle and any malignancies and any iatrogenic causes will be coming under that. And coming to the perimenopausal age group, the most common causes will be endometrial hyperplasia and malignancies. So based on these causes, we have to rule out from the history, then physical examination and the investigation. Investigation includes blood workup. We will be looking for any thyroid disorder or any coagulation problem, and we will be doing an ultrasound, that is a transvaginal ultrasound, to look for uterus, ovaries, and in uterus we will be looking for any anatomical changes, that is endometrial polyp, fibroid, adenomyosis, whereas in case of ovaries, we have to look for any ovarian cyst or any polycystic ovaries. So whenever a woman comes with abnormal uterine bleeding, we have to look for the causes from their history, examination, and then we have to investigate, and then based on that management will differ. Management of abnormal uterine bleeding will be medical as well as surgical. So whenever you have any symptoms of abnormal uterine bleeding, please consult a gynaecologist so that the necessary investigations will be done and appropriate management will be given.